This is from the community's side to say thank you and show our love and concern.
And I also acknowledge and express gratitude to the government of the United States for their interventions in this sector. It makes a lot of difference, and that is the reason why we are able to manage things and keep things under control. We give thanks to you. We express our sincere gratitude, sir. And I am very certainly confident that your participation, your interventions here will definitely have very significant outcomes. We believe a person of your caliber will not do anything just for the sake of doing things. But we are convinced and persuaded that you have something very deep in mind, that you have a deep commitment to this initiative, and we believe that we will go on ahead to achieve more success, manage things better, create more awareness, and help to, usher our community towards more meaningful lives. So I also take this opportunity to express my sincere gratitude to the presence of the faith-based church organizations.
Moila life story to koile te bichi lamba be jai jabo kintu moi khata ora amjan la develop share pro ma kilo kilo moila background developing da koi ne moila specialty ja direct ja be man sundur binai tora moila background develop amjan ja highlight ko do mon thai ka to mo be drug bichi use kari thai se alcohol use ko thai se to moila addiction do bichi lamba thai la moi tia moila age size ko le moila half of my age to moi already drugs there Takina highlight thakise to kali personi moi suku khuliala nisina ase to india kone during my addiction moi bishi struggle karina hala time thakise manula mon bia kara bishi thakise kote jaile bi society de mo ge reject garda family members kan barali mo ge reject kareta at the same time nijo bi nijo ke saman no hala din india kone ekdom bishi duk karina aya moi kitabi life the experience na kara jail khan de bi ja
ase तो दुनिया करेगना मोला कम्युनिटी खान लोगो दे काम करेगना आहा बितोर दे महान कम्युनिटी खान इतुला थीम हिसाब ते साइ जैसे कोले तो डेवलपमेंट पार्टनर्स सोचे कोले बे स्टेक होल्डर्स सोचे कोले बे इन एवरी प्रोग्राम दे महान के कम्युनिटी खान के है माटी के नाम खाना opinion खान लोए महाना सजेशन खान लोए इन्हें अपने ना महान काम की कुरी जाइए कोले भी महान के स्पेशली महान कम्युनिटी खान के एक ता स्पेशल चांस निशना दिगे ना महान के लीक कुरी के ना काम की होले भी इकिलो दे कुरू वाले जावले टाइम महान के दी था के आरो इतु ऊपर दे महान कम्युनिटी खान दो होइसे कोले तो महान कैंपिंग खान होइसे कोले तो महान चर्च खान ला साइट होइसे कोले भी महान members kan kumba lead korigena chaigena advocacy korigena sensitization program korigena mohan churches kumba do mohan ke nutritional support kan mohan ke mansal digena hishe aro presently itia United Baptist Church UBC da hambra 5 families ta nutritional support mansal digena aigena itia ta punya korigena jase holebi mohan itu lead lagati jaise bole to moi ekla bra moi itu khan kurole na pare apni hana support pi lage
idi Nagaland de bishi salba man kam kuri na ase holebi till now itakpi mahana LGBT community kan gide discriminate kore bully kore ase stigma bishi ase takina holebi mahan give up no kore mahan itakpi fight cross society han logote we will be fighting with our own people holebi mahan naharibo gona itakpi to journey to kore ase to achi moi at stand kori na moi ekta khushi kotha kobo munjai moi eko testimony share nokrobo holebi mahan laga community laga journey to short ekta ba koi dibo man first the goodwill ashram guna thagise to tade mahana members kuma to bimar ogna bi morishe ar kuma dita bi zinda ase holebi ita ami khan support Guardian Angel ba support korina agina aji ate platform de khar kori thaka last year ba mahan ita goodwill ashram to man bright Nagaland kori dibo guna Nagaland pura LGBT man cater korina empower koro guna man bright Nagaland guna nam kori disya ar ita part khan bra mahan ke support kuri ase aru dusra partners khan bra bi support kuri ase LGBT community khan ke aru mahan ki kori kole mahan LGBT community khan to man advocacy program khan kuri dage man lawyer khan ke 2018 di man program ekta kurise aru ina kurina aru mahan ke bisidi empowerment bi kuri dage every year mahan 10 June 20 June mahan community khan ke matina empower kuri dage dan ke na
in Nagaland through a small program called OVC under project founded by Prefer through USID. We are benefiting a lot. Through this program, we are not only get health related service, social protection service like birth certificate, Aadhaar card, etc. and also time nutrition support. We are also introduced, built our confidence and brought positive changes in our life. Therefore, thanking this opportunity, here on behalf of OVC, I want to say thank you, sir, madam. Thank you for your help, USID, JHU, and also thank you, Nagaland.
Yes, so, and then people get lots of discrimination, and then we say that hugging and then using same clothes or utensils won't affect people, but then still people are discriminating, and then they don't want to mingle with those people who are living with PLHIV. So that's the discrimination we are facing in the society, and then but then through after coming up of different NGOs and organizations, people living with HIV, they gather together in many forms such as alliances, collaborations, and network. And then we can see that in this present context,
Scientific medical advances. Presently, she is.
In those days, HIV positive means death. And as a consequence, people hid because of fear of stigma and discrimination, self-stigma, and many other issues that had prevented them from accessing help. But what I want to say is, with constant, persistent support, counseling, they eventually overcame their issue of stigma and discrimination. And they have become champions in that way. And we've already heard many communities saying that there's still stigma as discrimination is much less now, but it still persists. And so how important it is that we work towards it and collectively work towards it, so that people who have overcome, who have embraced, accepted their positive status can become voices in the community, can begin to share their personal experiences of the challenges and how they have been able to overcome that. And now today, there are different people who are able to share their own personal stories. The reason why I say story sharing is so important, because every one of us present over here has a story to tell. And nobody can tell it better than you, because you personally have gone through it. You have experienced the challenges. You've experienced how, through the help of people, through networks, through coming together as a community, you've been able to overcome. You've been able to overcome and begin to live a different lifestyle. And today, the stories of the communities, each individual is very powerful and impactful. And these stories does change not only mind, spirit, but also body.
Mr. Kyochamo P. is from the people who use drugs using community, working as the assistant director.
Most of us here must be aware that the first HIV case in the state was detected among injecting drug users in 1990. a time when the number of drug users were very high and stigma and discrimination was at its peak. Drug users were paraded on the street, put behind bars, put in traditional cage made of ichi wood, shot dead by national workers, and the government put a blanket ban on needle and syringes. As a result of these punitive measures, drug users became hidden and HIV prevalence became high among injecting drug users. Realizing the urgency to control the HIV transmission among high-risk groups, the government of Nagaland, with the support of National AIDS Control Organization, Ministry of Health and Family Welfare, Government of India, adopted the harm reduction strategy, thereby creating an enabling environment for our community to access needle and syringes and other HIV prevention services. Today, with the effort of government, NGOs, external donors, and key population, we have been able to bring down the HIV prevalence among injecting drug users to 2.53% in our state. However, at the national level, among all the population group covered under the HIV Sentinel Surveillance 2021, HIV continued to be highest among injecting drug users with 9.03% as per Nako Sankalap Report 2022. In the face of a growing substance abuse and HIV epidemic in Nagaland, and to support the government initiative of HIV intervention and drug abuse, some like-minded drug users came together and established the state-level drug users network in 1999.
Dr. Perez did her.
Their guidelines, their policies, and within that guidelines and policies, we also see that their dynamism in the way we approach the situation as well. And during that, in those situations, we have also want to extend our gratitude to partners like the PEPFAR CDC, the Global Fund partners, for getting in and trying to help us pilot the innovations, which we feel as community here, as our community members here, we feel that is going to be important for us in order to fast track our achievement towards halting the epidemic. So during this, lots of innovations were piloted with the support of the PEPFAR funding as well. And many of those innovations have also been adopted at a national level by the government of India in the NSCP 5. And we called it the revamping strategy, which was a big strategy already incorporated in the policy. And the revamping strategy is being implemented now fully in the National AIDS Control Program Phase 5th. So I would like to appreciate the team here. We also had a very dynamic, very community-centric leadership with the CDC, Dr. Melissa Nyandak with us. I think this is 4th or 5th visit that she has made since the rollout of the PEPFAR program in the state. And she has been very community-centric. She's very connected to the community. And we feel that those, creates the connections and understandings, and innovations get strengthened because of our understanding of the community needs and requirements.
USAID, Dr. Asha Hegre, Director, HIV Hepatitis Path, Mr. Aditya Singh, Johns Hopkins University.
Jimmy was always an inspiration to me because he lived openly at a time in the 1980s when maybe the United States was open and accepting in some ways, but still in most ways wasn't. And I love the speaker who mentioned we all live with discrimination. There's not one person in this room who couldn't raise their hand and say they've been discriminated against, maybe because of their religion, maybe because of their physical characteristics, maybe because of their personality, maybe because of their sexual orientation, maybe because of their gender identity, maybe because they live in the wrong region, maybe they're not part of the most powerful tribe. We all have faced discrimination. It's actually something that brings us together, that common suffering. And so for me, when we remember, our theme for the US commemoration of World AIDS Day and of PEPFAR is to remember and commit. So I remember that journey. I remember Jimmy. I remember his courage, which I saw right here today. And I remember his compassion. He didn't make it. He died about 5 years after he was diagnosed. We didn't have the drugs. We didn't have the coalitions. We didn't have the strength that this room has. So that is progress for us to know. And it's our obligation to remember those who are not with us. Because in public health work, we know we can only count those we've lost, like my cousin Jimmy. And good work is about people we can't count because they're alive and they're walking and they're contributing. During the pandemic, it was like this, right? We lost so many from COVID. But the good work, when a government stepped forward, when a community and churches and organizations and just everyday neighbors lent a hand to one another, so many people survived. And while you can't quantify that, that is what we are called to do. Today, the United States government comes here with great humility. We don't come here to teach. We come here to learn. We don't come here to preach. We come here to listen. And I want to praise India, the National AIDS Control Program, which has been acclaimed as a global model, and to thank you for letting us be a small co-author of just some elements of this. Maybe it's an idea you brought to us, to have bike teams that can go into the most remote villages. And that becomes part of a national strategy and inspires us back in the United States to wonder, maybe on an Indian reservation, by the way, different sort of Indians, but native reservation in the United States, how we can get to a remote area and treat people and find who they are. By the way, during Hornbill Festival, we're very pleased that we will see Native Pride, a group of Native Americans who will come here and bring their native clothes, their native traditions and songs to be with the native peoples here of Nagaland. And the theme for the World AIDS Day today, that we have here today of let communities lead, hasn't that always been the answer? Not just today. When the children and young adults who inspired us, thank you for singing. Can we give them another round of applause? It's scary enough to be an ambassador or a secretary and get up and speak. It's scariest of all to sing, or for the brave people who shared their stories here today.